Yeah, federally qualified health centers are uniquely positioned to care for everyone in the communities that we serve with diversity, inclusion, and equity. We care for everyone, regardless of their ability to pay or their station in life. The Primary Health Network is very fortunate to serve individuals in the Commonwealth of Pennsylvania and in northeastern Ohio. In our communities, the median age is older than the national average. Many of the communities that our health center served are rural, and there's limited access to other healthcare providers. Yeah, the partnership with Penn State University and Primary Health Network has been a wonderful opportunity for us to elevate the quality of care that we provide to older adults in our communities. Penn State University is so very, very well respected in this region, and we know that earning trust of the patients in the communities that we serve is extremely important. So this partnership really just elevated that level of trust from the get-go.
There were many factors that influenced us deciding to do the GWEP that focused on age-friendly care and the 4Ms. There are many factors, but I'll focus on a few that I think are really first and foremost. And first and foremost was really that this was a collaborative, interdisciplinary team science. This was really an opportunity really to do more implementation and quality improvement and really touch older adults' lives, and also work more closely with a primary care clinic in a way that we had never done before. And so again, just lots of factors that aligned really nicely, I think. The FQHC, again, really aligned with many of our values and our mission in our Center of Geriatric Nursing Excellence and within our College of Nursing. And that FQHCs serve older adults who have fewer resources. Many of them are what we call dually eligible, so they have both Medicaid and Medicare. And one of the sort of underlying concepts of age-friendly care is equity. And so, again, I've been a board-certified geriatric nurse specialist since 1990. And you would think since 1990 we could say we're reaching all older adults, but the truth is we're probably still only reaching about a quarter of older adults. And so age-friendly care, and I think primary health networks, are really about perhaps reaching older adults that we may not be reaching. And we really felt that the FQHC, or Federally Qualified Healthcare Center, helped us pursue, and not yet achieve, but pursue one of the aims of age-friendly care, which is equity. So not just to reach those who happen to show up at a academic medical center, but those who are in the community and might be more isolated. Our mission of our geriatric center is to improve the care of older adults in positive and person-centered ways, and I feel like that aligned perfectly with age-friendly care and the 4Ms, which are, again, what matters: medication, mentation, and mobility. I was doing care management in the home, and as a nurse, when you do care management, you follow a group of older adults across settings of care. So we would take care of them and meet them within the primary care setting, but if they went into the hospital, we would follow them there for continuity care, or if they went for short-term rehab, or if they went into the nursing home. And so this was the very first time that I had met this older adult, this woman, and she was 90 years old. And the first time that I met her was when I got a call from our administrator of the program and said, I'll call her Juanita. Juanita's in the hospital, and they put her on her psychiatric unit because she had pulled the fire alarm in her low-income housing building, and she was confused. So it turns out I got to know Juanita over a period of over 2 years, but it turns out what happened to Juanita that day was she had a acute confusion on top of a long-term chronic confusion or dementia. We call that delirium superimposed on dementia. And why did she have that? It's just a beautiful story of the connection of the 4Ms. What mattered to her was going out to lunch with her friends. She had actually worked as a telephone operator during the war, and so on Wednesdays she'd go out with them. She lived alone, she had arthritis, she had urinary incontinence, she had irritable bowel disease, and so she were on several medications that interacted. That day, she didn't want to be incontinent, so she doubled a dose of a medication called oxybutynin. She was also dehydrated. And she had also never had her dementia assessed. So this was the first time I'd met her. So she was in the hospital, and they had not recognized that she had a delirium superimposed on dementia. So you can see like all 4Ms working there, making a difference. And so we were able to address those 4Ms. We were able to taper medications along with her primary care physician, medications that were interfering with her cognition. We were able to establish a baseline dementia. We were able to bring in supports in her home to improve her function so she could do what matters. And she actually ended up staying at home for another year, even at 90, and then she eventually went into a nursing home. So again, it's those 4Ms in the case of Juanita were just really powerful. And of course, there were other things that were going on, in terms of her care, but the 4Ms really rose to the top in making a difference for her and allowing her to stay at home. My main goal for Age-Friendly Care PA is to use it to continually improve the care of older adults. And also, I think it's to realize that our work is not done yet. So one of the things that we do in our sessions and in the last 4 years of this grant that we've had is that we do what are called quick data minutes. And that's to feed back to the people we work with the progress that we've made, and which is a wonderful thing because I think it's motivating to them. But when we do that, we also see that we have more progress to make. And so, again, it's really, I hope that this is sustainable. So my goal is for this not to stop with our project, really to be sustainable so that they want to continue, and I believe they do, to do this care once the grant is over. My other goal is to be able to reach every older adult. That's the goal of Age-Friendly Care. And so even in the midst of this grant, we've taken every opportunity we can to reach out to other health systems. And so we're continuously, there is a great, the other role that I have is I'm president-elect of the American Geriatrics Society. And so there is still a paucity of providers and direct care providers and staff and people that care for older adults that are trained in the care of older adults. And geriatrics is expertise. And so we have a lot more work to do. So my overall arching goal is that we'll continue this work, and I don't ever plan on stopping.